your hand if you currently are a property owner that is renting, and you are just the owner and not the property manager, just the owner. Okay, that's really helpful. And could you also raise your hand if you are just a property manager? Okay, so you're managing properties, not only your own properties, but other properties? Okay. Raise your hand if you own and or manage 10 or less units. 10 or less units. Keep your hands up if you don't mind, so we can get a sense. Okay, how about if you own or manage 25 or less? 25 or less. Okay, is there anybody here that is in the range of 50? 50. Okay, all right. I see you, the Lancaster City Housing Authority, and others that are here, so thank you. I know that there's a broad range of property owners and landlords in the city, and that just helps our team understand a little bit about who's in the room. Also, I'm going to just talk for a few minutes and then turn it over to Rebecca, who will introduce herself. We have multiple members of the Lancaster City team that are here. If you are a city staff person, will you just please raise your hand? Okay, so those are the city staff folks. And then we have some folks here also from Penn Medicine LGH, because we are specifically talking about lead tonight, and they are going to have an opportunity to speak in a few minutes too. So let me first begin by saying thank you. Thank you for coming tonight. Thank you for responding to the letter that I sent with help from our team. I want to make an amendment to what we're going to be talking about tonight. In the letter, there was really 3 things that were outlined. One was around non-discrimination, one was about rental licenses and our systematic inspections, and the last one was about lead. Tonight, we are actually going to remove the conversation about non-discrimination. There's a lot more work that needs to be done related to that before we bring it back to our community of landlords for your feedback. Tonight, we're really inviting you to be part of a process around these 2 other areas that have to do with our systematic inspections, which you are all familiar with, and the rental licensing, as well as our lead ordinance. And many of you know that our lead ordinance was last updated in 2017. And so we're going to be talking about these 2 things tonight. I also want to underscore that nothing about anything is going to change until at least January 1st, 2023. Okay, I'm going to say that again. There's nothing that we're talking about work, but even the internal work that we've been engaging in continues to be refined, even from the presentation that we made last week to a couple of landlords to today is very different, because we are being informed by you. We want to do 2 things. We want to make sure that our houses that you all own and operate and manage, which are really important in the city of Lancaster, are safe for everyone, and especially our youngest children. I think that we can all agree that we do not want to poison our children. And we also know that through no fault of your own, you own properties where lead exists. We are not going to be able to eradicate lead from housing in the city of Lancaster. Really, ever. What we can do is make sure that those houses are safe for children, especially. And so that is the overarching goal of this conversation. So I just want to say it again. We want to make sure that our children are able to grow up and be able to learn and thrive. In order to do that, we are seeking your help, your partnership in figuring out the best and most efficient way to accomplish that. The second thing is that we want to really lean in on the expertise that you have in how you are managing your properties. I have a feeling that most people in this room are doing a really good job. And so we understand that out of all of the properties in the city, back of the envelope, there's maybe 10-15% of the units across the city that are not being managed well, that are not in good condition. And yet we also know that we have children who are being exposed to lead, that we need to attend to those. So there's a number of things that are happening simultaneously that are getting us to this point of needing to make some modifications to the lead hazard ordinance. So we're going to talk about some of the things that we're thinking about. We're going to invite your questions. We're going to do our best to answer some of them tonight, but I want you to know that this is part of a conversation that is going to happen and take place. Nothing has been introduced to council yet. You will have opportunities to continue to weigh in on this process. But for tonight, I just want to say thank you and to continue to situate the larger goal of making sure that our children are safe from lead in this equation. And Dr. Fife is here, who's the chair of our Board of Health, and he's going to talk to you a little bit about what we know about lead exposure in the city of Lancaster. And so with that, I'm going to turn it over to Rebecca, who's going to introduce herself. She's going to really be facilitating this meeting. And with that, I say thank you again. Really appreciate you being here. Thank you.
Thank you, Mayor. And thank you, Mayor, for your leadership over the past several years. This conversation around lead, as you know, started a long time ago. We continue to evaluate what's happened over the past few years. And so I just want to say thank you to the Mayor for her vision and leadership around the health of our children. Along the lines of health, I would ask that everyone has a mask on that's in this room covering their mouth and their nose. If you don't have one on, I would ask that you pick one up. There are some right over here by the door. So we want to make sure to keep everyone safe, our most vulnerable people safe. If we could all have masks, that would be great. Thank you. So as the mayor said, I appreciate your time. I appreciate that you're coming here tonight to talk about your perspective. And we believe collectively as a community that we can do better providing safe and quality rental housing. And we have started the process of developing a concept. We proposed this concept to council on September the 7th. We've developed a website, sent out letters, and right now we are here, as you say, on the map. You're here, we're at community feedback and input. And we had considered taking this ordinance to council in November. However, we wanted to slow down and really get the feedback that we needed from the community to have the best possible outcome to reach the goal. So we've taken a little bit of a slower approach so that we can really hear from you and take the time that we need. We have not yet developed the ordinance. So we have not written the ordinance, we don't have a draft. We presented a concept and we're sincerely seeking feedback tonight in order to be able to write that ordinance. So this is sort of a little bit of our process so that you have a map. We are in the process of focusing toward the final ordinance. We started with several big picture ideas related to lead safety and rental ordinances, have gotten input from staff, some neighborhood groups, Lancaster City Housing Authority, and now we're leading into specific landlord input and input later in the week from child care facilities. So we are really honing in on what is going to work so that we can meet the goal. And over the past few months, the city staff that have been working on this we have been curious about your experience, curious about what's been happening, and have been listening, I believe, courageously and creatively to try and really get to the root of what is happening in our community. And that's what tonight is about too. We want to invite you into the process and encourage you to be curious and courageous and creative this evening with us so that we as a community can really work together. Our goal is safe and quality housing for all. As I mentioned, your input really matters, so thank you. And as the mayor mentioned, the major changes are not going to be effective until January of 2023. I have given you index cards on the way in. If you don't have any, you can raise your hand. We have some additional ones. please, as we go through the presentation, write down your questions, write down your thoughts, your concerns. We want to hear those, and we'll have an opportunity to collect those and answer some of those tonight. We're going to start with the little who's in the room. We already did a few of those. And then we're going to do a little bit of an activity and take a short break while we collect the cards, collect the feedback, and then we'll have a panel of staff here and the mayor to answer your questions and try and collect some themes and answer as many as we can get tonight. So I was going to do this by phone, but for expediency, I'll ask, we already asked the question about how many rental units you own. So if you can raise your hand if you've been involved with a regularly scheduled rental property inspection with a housing inspector from the city. Raise your hand if you've been involved in that process. We're going to be talking about that a little bit tonight. How many of you have had to submit or have submitted a lead safe certification to the city before because you've had kids 6 and under in your properties? It's a fairly good amount. Great. So we're going to discuss 2 areas as the mayor mentioned. Rental licenses and systematic inspections and lead safe certifications. Those are the 2 major components that we're going to be talking about this evening. In front of you, you should have a chart of really the summary of the proposed changes. And I'd like to highlight a couple of them for you, but there's also a summary in front of you. And I point you back to the website also that was on the letter that you received for more information. But if you want to refer to that chart, there are a couple of major changes, again, going into effect 2023. Right now, you need to apply for your rental licenses every year, and we're proposing that you will need to apply for that rental license every other year to make things administratively easier for you and easier for us, and to align our systematic inspections and our lead safe certifications all together with the licensing process. Right now, we are on a rolling rotation of inspecting every unit every 4 years. And our proposal right now is to be able to vary the cycle based on the property quality. So we can put more effort and energy into properties that need more monitoring, and not as much energy and effort into properties that are well maintained. So looking at keeping most of our properties on a 4-year cycle, but going back to properties that have a high level of violations more frequently, so we can really support the community in safe housing. Again, these are the 2 major changes. There's some more on your sheet there, and I welcome your questions. We're going to have time for those as well.
Changes in their ability to do fine motor things, so ability to things you want kids to be able to do, to pick up things, to be able to write. You can see them having trouble paying attention. About 1 in 5 kids who have attention deficit have an issue with lead poisoning. So also then as an adult, we see a high blood pressure and kidney disease. And you see difficulty with like being able to organize something. So this is something, this is an issue that will affect them later on as adults and affect them as far as like organizing their life. And so they oftentimes need a lot more support than a usual person. Major issues with memory, difficulty like with cognitive flexibility, so that's learning, and difficulty forming abstract concepts. So like kids who have lead poisoning have a real difficult time in elementary school, in high school, and then there's a good possibility they will not actually go on to any kind of education beyond that. As far as fetal development, there's also a significant issue with pregnant women, and then pregnant women actually getting lead toxicity and it going to the fetus. So we can go on. Thanks. So these are the places that lead comes from. The main place that lead comes from, and this is why I think you're all here, is it actually comes from dust, paint, and soil. And then the issue with soil is because the paint on a property goes into the soil, and then there's dust when people are remediating or renovating, and that renovation is actually what causes the dust. And then kids who are at the highest risk are kids who put their hands in their mouth. And kids who put their hands in their mouth are 9-month-old to usually about 2 years. And that's when the brain is most at risk. So that's why we're really concerned about that group of kids. And it is in some other things, and certainly like there's been the toys from China that you see the lead in, but that's actually a very small portion. really it's mainly the dust, paint, and soil. And then there's some remedies and cosmetics, and then there's some cultures that actually use lead in some instances, but it's pretty rare overall. It's really the dust, paint, and soil. So this is what I wanted to kind of bring up mostly. If you look at this graph, basically for any lead level above 0, you have a loss in IQ points. So when I see a child in the office, when I see them and their parents, and I do a lead level at 1 year old or 2 years old, and it comes back at 20, what that means is they may have lost at that point 15 to 20 IQ points. 15 to 20 IQ points is a lot of IQ points. The average IQ is 100. And once you actually get to 70, it's severe cognitive impairment. And so that's a big deal. So and it's not something that's reversible. So I see them, I do their lead level, and then I can try to help them decrease the lead that's in their system, but I can't do anything else. The damage is already done. So that's why I think all of you are here to try to prevent that from happening in the first place. And that's an awful thing to tell a parent, that, well, yes, your lead level is 11, your lead level is 20 or 30. And I've had kids this year who it's actually been 60 and 70. So to have a kid that lost 40 IQ points, that's a huge loss. That kid has gone from potentially like an average IQ of 100 to never having the ability to do well in high school, never having the ability to do well in middle school, and not being able to potentially like even read. Like that's a huge loss. So we go on. So this is the problem for Lancaster. Lancaster County is a little hard to read, but we actually have, you can go on actually, go down that whole thing. So Lancaster City has actually about 11% of kids in 2019 who actually have a blood level greater than 5. And so when we kind of make that mark at 5, any lead level is a problem, but greater than 5 is kind of where we at least make a mark and we say, hey, we need to remediate or do something to prevent that from happening. And 11% of the kids in the city actually have that who we've tested. And then as far as Lancaster County, it's about 6%, and we're as a county the 4th worst in Pennsylvania. It doesn't have to do with like anything except probably housing stock, and then the way we deal with our housing stock. So the rates have plateaued, but the other issue is we also have the youngest population in the county, or in the state rather. So our kids are the youngest in the county compared to all the other counties per capita. So we have actually even more responsibility to take care of our kids. And then we have the second lowest screening rate. So we're actually not great at screening either, and this is actually comes upon me and comes upon like my colleagues in saying, hey, we need to screen better. So we can go on. And this is where actually I just kind of brought up Flint. Flint got a lot of press in the news. We are so much worse than Flint. And so you can see us on the front pages of like national papers if we don't do things. So it's kind of worthwhile to kind of just at least do that comparison. And the reason this is 2013, 2014 is Flint was in the papers in 2013, 2014. Our estimated lead level has not changed much since then. So we can go on. And this is actually the big issue. If you see in the county in the middle there, that brown, that's actually the housing stock. And so those are the houses that were made after before 1978. And so we certainly have in the city a lot of houses that were made before 1978. And that's when the lead ordinances changed overall the nation, and we weren't making lead paint anymore. And so that's actually what changed things dramatically, in addition to what happened as far as unleaded gas. So there was no more leaded gas soon after that as well. So this is just an end thing. So let's talk about primary prevention. So primary prevention is like not getting that kid in the office to have an elevated lead level. We actually prevent it by preventing it happening in the housing. So that's kind of the goal, is that we'll check kids, but at the same time, we don't want kids to actually have an elevated lead level to begin with. And that's where you can come in, and that's where the discussion of the lead ordinance is. And it's much cheaper to do that. So if you look, basically it's $50 billion nationwide how much we spend because of lead toxicity. And basically, the average is if you spend $1 in it, it decreases that by $17 to $221. That's a huge decrease. And basically, there's about 500,000 kids who actually have a lead level in the nation beyond 5, and that 23 million IQ points are lost every year, which is an enormous number. So that's really all I wanted to talk about, and just to make sure that you guys had just a general sense of the science with lead and like what it really means. So again, it's not life or death, but it certainly is quality of life and a huge, huge impact on what we can actually do for our kids and what we can do for like our community, because those are going to be the kids who kind of grow up here in the city as well. So thank you.
Thank you so much, Dr. Gray. We started this conversation, and the mayor started this conversation because we think we can do more. We think we can do better. We don't need this number of kids. 94 kids were diagnosed with elevated blood levels in 2019 in the city of Lancaster. And that has plateaued, as Dr. Fife has said, that's a lot of kids. And that's a lot of lower IQ. So our proposal on the table, and again, you have index cards, so please note your questions, your comments as we go along. 3 things I want to highlight, and again, you have the chart. Our current requirement is that lead safe certification is required for homes, for properties with children 6 and under living or visiting that were built prior to 1978. The proposed legislation is that lead certification is required every 2 years at the time of license renewal for every rental property. Currently, Lancaster City Housing Authority is exempt from this requirement, and we're working closely with Lancaster City Housing Authority to be able to provide lead safe certification and meet their federal regulations as well related to lead safety for each and every one of their properties. Currently, daycare facilities obtain a lead safe certification prior to opening. That's one time. And what we're proposing now is requiring all child care facilities to maintain lead safe certification and to provide that certification to the city every 2 years. So for those of you, there are about maybe 2/3 of you that have not done this process. I'm going to go through this rather quickly. We're going to stay at a high level tonight and talk about the policy, but I just wanted to make sure we define what is a lead safe certification. So a licensed person, a licensed lead paint risk assessor or inspector conducts a clearance examination. There's 2 components. They do a visual examination to ensure there's no chipping or peeling paint or no construction debris. And the second thing they do is to take lead dust wipes, sampling on the floors, windowsills, window wells, per the EPA standards. And once that clearance is completed, if the house passes, then the following documentation will need to be submitted to the city at the time of licensing. The lead safe certification signed by the lead risk assessor or the inspector with the passing results of the lead dust wipe and a copy of their license to prove that they are licensed to be able to perform said testing. And here is a picture. It's one piece of paper that you as the property manager, owner, will be required to complete and have signed by the lead risk assessor or inspector. The second component that we're proposing to change is strengthening our response to children with elevated blood lead levels. This applies to both rental properties and home ownership or owner-occupied properties. So if kids have elevated blood lead level in either one of those cases in any properties, we're looking to strengthen our response to that family. So right now, code officials do not have the authority to help get the child out of the house. So as the investigation is going on, the kids can stay in the house. We're proposing that we give the code officials the explicit authority to condemn the property as unsafe for those kids 6 and under, to get them out of the property quickly. It's not the whole property, it's not for everyone there, but the kids 6 and under are not able to stay in the case of a very high elevated blood level and in the case that the property undergoes this environmental investigation and shows that that is the place where the child is being poisoned. Particularly when kids are undergoing therapy for lead poisoning, being in that home and continue to be exposed to lead is very dangerous for them. Right now we're giving 21 days for the property owner, property management company to get the environmental investigation, and we're proposing that the city is able to order that and or conduct that investigation right away. Again, if we give 21 days, the child is still in the house, possibly undergoing treatment and continuing to be poisoned through that time. And that's just too long of a window. So we're really looking at shortening that time and increasing our response. So my last slide before our activity here. I just want to point out a few keys to success. Again, we have had quite a number of conversations between September 7th and now, and we've learned quite a few things, and we're continuing to learn. One of our keys to success is going to be to incorporate this feedback that you give and the feedback that we've received into this ordinance development as we go along. One of the other barriers that we are aware of is that the workforce is not prepared at this moment to do all these lead clearances and the lead remediation. We're working as a community, both through the city and through LGH, to build that capacity over 2022. In 2022, again, we have a whole year where we're going to provide technical assistance, resourcing to homeowners, landlords, to be able to understand the process and to be able to meet the requirements as we go forward. So we have that whole year period to do that. And then on our side, we really need to streamline and improve our city implementation processes to make things easier for you, more understandable for you, and bring it all together in an easier package to be able to meet the requirements in a clear way and to be more transparent about what we're doing, when we're coming, and what's happening related to, let's say, certifications as well as systematic rental inspections. So we really want to streamline that together. Yes?
Before we go on to the next part of this, which is really about getting your questions, I want to just also acknowledge Alice, who's here representing LGH Penn Medicine in addition to Dr. Fife. And this part about the EBLL, raise your hand if you've had a child that has been in one of your properties that has had an elevated blood level. Just anybody? Okay, a few of you. Okay, so I just want to underscore a couple of things. One is that Rebecca mentioned we've been working with the Department of Health Bureau of Epidemiology to actually access on a regular basis children in the city of Lancaster who have tested and who have an elevated blood level. That means that the data that Rebecca shared that we have just from 2019, for example, because 2020, 2019 we had about 93, is that right, Rebecca? 94 children in the city of Lancaster who had an elevated blood level that was reported to the Bureau of Health, Department of Health Bureau of Epidemiology. Of those, the city was notified of 30. So we only found out about 1/3 of those cases. Moving forward, we will be notified for every one of those cases, which will automatically trigger a response from the city. The second thing that I want to underscore, and maybe Alice or Dr. Fife want to speak to this, is that as part of this larger initiative that LGH and Penn Medicine are also participating in and leading, not just in the city but in the county, will mean that the primary care providers that are affiliated with Penn Medicine and LGH are going to increase testing among pediatric patients that they see. And so, I don't know, Alice, if you want to say a few words about this, but this is all just to say that we know that we have more children that have elevated blood levels than we are aware of in the city as it relates to our housing. That is one side of this coin, and it will automatically trigger a response that will need to be made in all of those homes. We also know that once those children are exposed to lead, we cannot take it back, which is the other side of this in terms of being proactive in addressing lead and working in partnership with you so that you don't ever have a child in any of your homes that is diagnosed with an elevated blood level. So that is the partnership that we are seeking. There's just two sides of this equation that is happening simultaneously, and why your questions and your comments and your feedback as property owners are so important. So Alice, do you want to just introduce yourself and say a little bit about the initiative?
Okay, thank you, and thank you everyone for being here. This is really exciting, just sitting over there and looking at how many people are here, and I know there's lots of things to discuss ahead of time, but I'm here on behalf of Penn Medicine, Lancaster General Health, and just to say that we're super excited about the relationship with the city and looking at tackling this issue together. I've been doing community health work for over 2 decades or more, and listening to our physicians, including Dr. Fife, when the issue of lead came about, that you may not die from it immediately, but your life changes dramatically. So anyone that feels like you've been exposed to it when you were younger and things happen, your life could be totally different. Maybe it's fine now and you're happy, but for many children it is really an issue. So when we looked at this issue of lead poisoning 20 years ago or so, we did start screening children a little bit better, and we tried to do the best we could with that. But the bottom line was we realized we can screen as much as we screen, but it's the house that's sick. It was the house that has the issue where the child spends so much of their time, and it could be at their grandmother's, it could be in their natural home, it could have been childcare. Wherever the child spends time, that exposure is what's making the child sick. And so for us, it was healthcare. Traditional healthcare didn't have the answer. We don't have the answer. The answer is really with you, and the answer is with the house. And it's not pointing fingers or any of that. What's so exciting to me is that we have an opportunity to do this all together. We really are dedicated to it. As Dr. Fife and his colleagues are at the point where they're going to increase screening, so we're making a commitment to the city that all our physicians are going to do a much better job screening. The physicians are excited because now they know the city has their HUD grant that they've been working on already for several years. LGH is joining the city, where our board of directors committed $50 million for over 10 years. That's how important that they realized lead poisoning. There's a lot of issues we could have thought about what would be our priorities. We are focusing on lead, and we're going to help with the remediation, with the income eligibility for the families, and being able to help remediate, get the lead out, be able to put them in a hotel or somewhere while the house is being fixed, things like that. So we're super excited about that. And beyond that, the physicians are so excited and dedicated. So when Dr. Fife went out to a social event sometime, maybe pre-COVID or with COVID with masks on, who knows what happens with social events these days. But anyway, they talk to their colleagues. So we have actually a separate coalition that has all county primary care physicians that are going to start screening. So it's not just LGH, it's Union Community Care. They've been doing this for many, many years, but it's more coordinated. We're going to be able to help them make sure that when they order a lead level, that the family and the child actually gets tested, because it's not easy. You have to go to the lab, so you work 2 jobs, things happen. We're actually going to be able to do, if we need to, go to the home and do the testing. So to the mayor's point, we're going to look to really do our part. But if we do a good job, we're going to be actually identifying more. So this reminds me a lot of when, as a community, we started tackling child abuse, where we felt that the disclosures in child abuse were really at a low level compared to state and national, because we weren't doing a great job of recognizing child abuse and identifying it. And what we did is we started saying we got to get rid of child abuse. Well, before you get rid of anything, you have an increase, because you're increasing awareness, you're developing systems and policies that are going to make a significant difference. And that's where we are right now. We're in partnership with the city. Super excited. I had some formal comments. Can I read that? Or is it time now or not? Just tell me. Would you rather not? I can do it later.
We're gonna have, at the end, we're gonna have a kind of
Open
like
mics,
a
I'll do
open
that
mic,
then,
and
yeah.
I think that would be a really good
Okay.
time to get your perspective as we gather everyone's.
Yeah.
That would
So
be great. Thank you.
that would be fine. Yeah. So, but right now, just basically saying that it's us and all the other primary care physicians and pediatricians certainly in Lancaster City, that services the families, that are all working together outside of these meetings to make sure that they improve screenings and that every child gets screened, not just waiting for someone to come with some sort of complaint. So thank you.
Thank you so much, Alice. Thanks for being our partner in this endeavor. So now, this is the time when we're going to start collecting questions and feedback. we want to make sure to get to as many questions as we possibly can. So this is a process that we're going to be following. I passed out index cards. If you don't have any, you can raise your hand now. We can give you some. Questions, comments, concerns. Any of those can go onto your index cards. And I would like to say that we're going to post our questions on the boards of the sides of the room. So on this side, there's it's a bulletin board. On this side, there's a bulletin board. That way you can, we'll have push pins on both sides. Write your questions, write your comments. Also, city staff are here. One more time, if we can raise your hand if you're on city staff and here to support. Here I have health officers in the front, couple people from the lead program here. Our city solicitor, Barry Handwerker, on that side of the room. Chris Delps, our director. The mayor, Jess King is in the back. We're here to answer your questions, have conversation informally over the next 10 minutes or so. Write down your questions. We're going to post